Hello, everybody. My name is Michal, and I'll be presenting to you about networking to manage imposter syndrome. And it's obviously making me feel like a massive imposter, even, giving this talk. And I'm a senior clinical scientist and a fourth-year HSST trainee. And I work in the medical physics and the clinical engineering department, but I'm actually doing health informatics for my specialism. But I guess on that a bit later. So you've probably heard about the Dunning-Kruger effect, so you might be a bit bored hearing about it, but it's probably a good place to start when talking about imposter syndrome. And it's something to do with the fact that the more you know, the more you realize your limitations. So if you know nothing about something and you realize that you know nothing about it, then you know where you are. But the problem is that once you start learning a bit, your confidence might grow above your knowledge, which in this graph is called peak of Mount Stupid. But then you quickly might enter the valley of despair, where the more experience you get, the more you realize your limitations. And even though you're actually probably in reality quite confident, you might think that you're a bit useless. So perhaps the first thing to mention with regards to imposter syndrome and perhaps feeling a bit silly and clueless and stuff like that about yourself is this paper from, I think, 2008, which talks about the importance of stupidity in scientific research. And I guess it's not just in research, but in scientific work in general. And part of the problem of what we're doing is that we're quite often trying to solve problems that nobody actually knows how to solve because nobody has solved them before. And we feel like perhaps we should straight away know the answers to those problems, but no, we don't, because they are new problems. And if you're encountering such problems on a daily basis, no wonder that you might start to feel uncertain about yourself. And I thought at this point it might perhaps be useful to just talk a bit about my scientific and healthcare journey. So I started training as a basic scientist. I did a bit of voluntary work in pre-hospital care, and I developed an interest in bioethics at that point. And then I did my STP in critical care, and I ended up working in evaluation and in vascular ultrasound and a bit of health informatics. So I had my fair share of starting and stopping something and feeling like I'm starting back from the beginning. And I guess the question for me was well, how do I know as a clinical scientist that I have any competence at all? Because I guess that's kind of what we're trying to always establish for ourselves. How do we manage the feeling of competence? And this can be particularly tricky if you walk among giants. If you have great tutors and teachers and lecturers who are the top of their field, well, you might feel small among them because they're competent people and they're great people to learn from, as opposed to a situation where your manager might be incompetent, and that might actually increase your own feeling of your own competence. But yeah, how do you manage the question of competence? And I guess the first thing is here, who defines what does it mean to be competent? Is it you yourself, your manager, or your lecturer, perhaps? And for each of us, this might mean something different because it depends, what do you want? Do you want to be a generalist, a specialist? Do you want to focus on research? Or do you want to develop your own niche? How do you want to develop your career? Because two people working in the same specialism at let's say the same band even might have a slightly different skill set. One might have a really specific interest and the other one might have a maybe broader interest and will be on average, pretty okay at all the things, whereas the specialist might be a bit worse off on some of the things, but might be really great on specific skills. And that doesn't mean necessarily that one is more appropriate than the other, but depends on the on your job and how do you want to shape your career, because time and resources are limited, so you can't be great at everything, and you need to decide when is it to be good enough at what. And I guess, well, LinkedIn is perhaps a good thing to mention on networking, but it's good to start collecting evidence and putting it and record it somewhere, because one of the things that might be helpful is to establish what you actually have done and have a record for it. So whenever you feel down and useless, you can always go back to something and be like, no, I've done this tangible piece. I can't be that bad. You can't keep telling yourself, for example, that you're a bad academic if you have a good portfolio of decent publications. You can't complain that you're a bad clinician if you get consistently good feedback from your colleagues or from your patients. But this tangible evidence matters. And in one case, and also in some way, it can demonstrate your competence to others via networking. But there's also another important aspect to networking, and that's because if you want to develop your skill set, you don't know where the opportunities might be. Are they locally within your team or your institution, or are they more regional and national? And if you're quite junior in your career, and I guess the problem is with a talk that's aimed at HSST people, some of us start the HSST on a band 7, maybe reasonably fresh after our STP, and some of us are quite well established. But especially if you're junior, you might not actually know where the opportunities are, and neither might perhaps your manager. So networking allows you to figure out where those opportunities are. And those opportunities are important because if you network with people from other places, you quite often realize that people are in the same boat. And it's always a bit of a tricky thing because you don't want to be the type of person who moans all the time. But sharing your struggles can be quite a good thing, in the sense that you discover that your problems are not unique to you, and others in a similar place that you are face also such problems. So they're not because of you. And if they are amongst your peers, or maybe on people who are maybe a bit more advanced in their careers, well, it can give you reassurance that it's nothing to do with your incompetence. The more you network and you take up, the more you network, you might realize that other people who are in a similar position as you, or maybe a bit more senior, are actually less competent, at least at some things, than you are, and that you hold some expertise, at least in some things. It's also an opportunity to learn best practice. So if you do identify that you're maybe perhaps a bit not too sure about some of your skills, you can learn from other people through these opportunities. And especially if there are any voluntary opportunities and things like national organizations and stuff like that, they offer you to develop skills that you wouldn't be otherwise able, but then you can use in your showcase of skills when you're maybe applying for a new job, or if you're using these things as reassurance to your own capability. And it's not so much fake it until you make it, but the fact that you're putting actually the effort to develop those skills just in a different, perhaps a slightly different setting than your day-to-day job. And through all these, so when you're networking and perhaps taking up some of those opportunities, this can help you to develop some leadership skills, for example, by becoming a trustee of an organization and reassuring yourself then that you do have those skills. It also allows you to develop skills such as negotiation, time management, and assertiveness. Because once people realize that you become competent and ask you to do things for them, and I guess that's really something that you can take as a hallmark of being competent, is if other people are by themselves coming to you and asking you to do things, you might have to say no to them because you simply don't have the time to do those things. But I think one of the things that this graph doesn't show straight away is that, at least in my experience, even within the same, let's say, knowledge domain, like you might be repeating this cycle several times, and but perhaps that's something to do with developing more and more specialist knowledge, that you then realize that in that subsection, you still lack a lot of expertise in. Or it might be that you move to a more senior role, and even if you stay within the same clinical area, suddenly you're put in a leadership position where you have to manage people, and it's not just about the clinical and scientific work, but about people management. But I think, again, networking with people who are in similar job roles than you, who also manage people with whom you can share your struggles, can give you reassurance, at what point you actually are, and maybe give you tips and skills to develop, your whatever people management a bit better. So I don't think like imposter syndrome is something that just goes away once. It's something that you have to manage, throughout your career. But I think networking can help you both develop the skills that you lack and establish your expertise, at least in part of the domain you work. So, for example, I gave a talk the other week, and I had two people who are probably much more senior to me. But giving the talk to this group of strangers allowed me to figure out that actually there's at least one thing that I know more about them than they, even within the discipline in which I'm training, which is quite reassuring. So I'll finish now, and thank you for listening.